Good afternoon. We've all done the meditation, loved or hated the bodily sensations we felt during it. For better or for worse, we've participated in processes that should reduce our levels of anxiety and stress and lead us to have a better quality of life. But what is really going on in our bodies and brains after we finish exercise of yoga or meditation? Can we really see an impact in our health, mentally and physically, and the way we handle stress every day? If you paid attention during this class even slightly, you'll know the answer is yes. What I'm going to show you today is one of the first studies to truly link mindfulness to observable results in both brain and immune function. Although there have been many since, the study has made one of the big first contributions to the field. Today, we're talking about how practicing mindfulness yoga impacts your brain and immune system. I'll begin by giving a brief background of the context in which the study took place. Then we'll explain the hypotheses and methods of the researchers, continue on with the results, and conclude with implications and limitations of the study. So, going into the context of when the study took place in 2003, at the time, this is where I have to insert a lot of stuff, photos. But at the time, hospitals had already begun using yoga and meditation for treating patients with chronic stress, pain-related disorders, and chronic diseases under mind, body, or integrative medicine. However, most research to date has been about immediate changes going through one's body during meditation, rather than focusing on the long-lasting effects that meditation would have and that mindfulness practice would have on the body and the mind. This is in direct contrast with what most meditation practices were boasting, an impact on everyday life, not just in the moments that one is meditating. So, therefore, the researchers decided to investigate enduring changes detectable in baseline brain function and brain activity in response to emotional challenges. They focused on emotion-related brain activity because meditation, in research that was done thus far, was found in many studies to reduce anxiety and increase positive affect. Therefore, they focused on the frontal regions of the brain, particularly the left side, as activation in several anterior regions there is observed during certain forms of positive emotion and in subjects with dispositional positive effect. Therefore, the hypotheses of the researchers going into this experiment was that because meditation decreases anxiety and increases positive affect, subjects practicing meditation would show an increased left-sided activation versus a controlled waitlisted group. Second, because meditation has been shown to increase immune function, meditators would show greater antibody response to a foreign body. Thirdly, the magnitude of a change toward greater relative left-side brain activation would be associated with an increased antibody response. So, how did they end up testing these hypotheses? In their study, they took in 42 different subjects that were workers at a biotech company in Wisconsin. They were randomly assigned to two different groups. One that would go through an 8-week meditation program, and the other that would be on a wait list and on the same timeline not receive the same meditation as the first group. This will also be broken up better. In the method, so the way that they tested the brain activity in the brain was using an EEG, which puts 20 different site indicators over across the scalp, in which they focus on 4 that we'll go into a little bit later. They do 8 one-minute baseline trials, in which 4 of them have the subject's eyes open and 4 have their eyes closed at different intervals throughout the series of the process. And we have a timeline coming up that will show that. Additionally, in order to test the brain activity in response to an emotional stimulus, they did a writing exercise and tested and scanned the brain 1 minute before and 3 minutes after writing about both one of 3 most positive and 1 of 3 most negative experiences in one's life. To test the emotional impact of that, subjects went through self-diagnostic PANAS and PSI reports where they responded to a bunch of different prompts and said how they were feeling throughout. And in order to make sure that subjects were keeping to their meditation schedule, they kept logs of their daily meditation as well as attendance was kept for the weekly sessions. So, the meditation class that they were practicing was mindfulness-based stress reduction that was formed at the Massachusetts University Hospital that consisted of one 1.5 to 3 hour class a week for 8 weeks, in addition to a 7-hour long silent retreat, the week 6 of 8 weeks, and a 1 hour a day for 6 days of the week that you're not having the guided class with an audio guide alongside of it. So looking here on the timeline, we have three different time slots that we're interested in. The first is time 1, in which the subjects started in the study and broke off into their original groups. Time 2, it comes at the end of the 8-week meditation cycle, and time 3 is 4 months afterwards. At each of these time intervals, the EEG was taken of the brain scans to measure activity, and at time 2, an influenza vaccination was administered to all of the subjects around November to see eventually what the antibody response to the influenza vaccination would be. So, going into results, this is really very sloppy, I'm just warning you. Okay, so going to the results, you can see here that from the very beginning, from time 1 to time 2, so just over the course of the meditation practice, the controls in the white bar graph block didn't have any significant change in what they were feeling in terms of anxiety after the emotional tests. However, the treatment drastically reduced after they had undergone the mindfulness training. Additionally, when we look at the brain scans, this is the wrong graph. Sorry, but when we look at the brain scans again, after undergoing treatment, we can see that there's a much higher amount of activity in the control group versus the or in the treatment group versus the control group, based on a specific electrode site in the brain, based on the EEG. I really do. Can I stop stumbling through these?
Are you okay? Yeah.
Okay.